guys, I'm Anagha. Today we have with us health and wellness influencer Dr. Jagdish Chaturvedi. In this video, we'll be talking all about glucometers, the different types and how to use them the right way. So to begin with, Doctor, can you tell us the importance of maintaining blood sugar levels?
Yes, managing your blood glucose levels is an important part of maintaining a healthy lifestyle. And for most people, measuring your blood glucose every 4 to 6 months is quite all right.
That's helpful. What about those with serious medical conditions?
Yes, if there are serious medical conditions that affect your blood glucose, then it is recommended to have more often and frequent accurate readings of your blood glucose.
So you can measure your blood glucose levels with a glucometer, right? What exactly is a glucometer?
Yes, like you mentioned, a glucometer is something that measures the glucose levels in your blood. Now, for those who have diseases that affect blood sugars, like diabetes, it's very important to measure the blood glucose levels frequently. Because in these people, they are not able to either produce adequate insulin or the insulin is not being used properly. So that's why the blood glucose levels are high.
That makes a lot of sense. So are there any different kinds of glucometers?
Yes, broadly two types. The most common ones are lancet-based glucometers, where you need to take a blood sample to test your blood glucose levels.
Okay.
There have been some advances in non-invasive glucose monitoring, which do continuous monitoring. But today we'll mainly be talking about lancet-based glucometers and continuous glucose monitoring devices.
So let's get started. So doctor, can you tell me how to use a glucometer and whether you have any tips to use it the right way?
Yes. So a lancet-based glucometer requires a blood sample for it to give you a reading. And the continuous glucose monitoring devices, they have a sensor, a transmitter and a monitor, and they have to be placed once a week and they give you continuous readings. Now for a lancet-based glucometer, it comes with a lancet holder and a lancet that needs to go inside it. A lancet in simple words is the needle that you use to prick.
Oh, okay.
And then it has a monitor and it has a test strip. So when someone wants to take a reading, the first thing to do is wash your hands with warm water properly. What warm water does is it improves the blood flow to your fingertips. You can also rub your hands against each other and warm your fingertips.
Okay.
After that, you need to twist this cap and take it out and then find your lancet, grab the lancet and place the lancet inside. And there is a groove with which the lancet needs to be aligned. Place the cap back and twist it. And as you can see, you can adjust the depth of how much the needle has to go.
Oh.
Different people have different levels of it. You can try it a few times to understand which is appropriate for you. Once that is done, get a test strip and place it onto the monitor. The test strip, sometimes you get a testing liquid and you can test the liquid to see if it is accurate. And it's always recommended to do that. After that, once you're ready with your lancet holder and the lancet is loaded inside, choose the side of the finger. That's important.
Why so?
Because the bulb, no, the central part of the finger has more nerve endings.
Oh,
so that can
okay.
be more discomforting. It can have more pain.
Okay,
but the
okay.
side has lesser nerve endings, so it may be more comfortable. And when you do that, make sure that you don't take the first drop of blood. Wipe off the first drop of blood because that may be contaminated with the needle.
Oh.
Take the second drop of blood and place it onto the test strip and then get the reading. And then wipe off your finger clean. And then it's always recommended that you throw away and completely discard the needle and use a new needle the next time for safety.
So how long does the reading take?
The reading typically takes a few seconds and
Okay.
it will show up onto your monitoring, the monitor of this particular device.
Okay. So doctor, what about continuous glucose monitoring?
See, for continuous glucose monitoring, the process has to be done once in a week.
Okay.
And like the name suggests, it gives you continuous readings. And there is a sensor, and that sensor can be placed either in the abdomen or at the back of the arm. And while doing that, you have to disinfect the area nicely and then place the sensor, and then the reading can be recorded. Sometimes the monitor will directly show the reading, and in some devices you have to take the monitor close to the sensor to show the reading. And the newer devices also allow you to work with your smartphone.
Oh, that's very convenient. So doctor, when should one take the test?
So for most people with deranged blood sugars, it is recommended that they test their blood sugars before meals or before they sleep. And it may be different for different people. So I recommend that you consult with your endocrinologist or your doctor to decide when is the best time to take these readings. But whenever you take it, it's important to take them consistently.
So I have another question.
Yes.
Do all devices provide the same reading?
Well, it's common to see some variations, but that's why it's important to stick to the same device and same brand. In the same device and same brand, if you're seeing a variation that's too different, then better to get your device tested and then calibrated by getting a blood test in a formal way from a lab and then selecting your device accordingly.
Thank you so much, Doctor. I'm sure these tips will help our viewers understand glucometers and how to use them the right way.
Thank you for having me.